awareness. We are going into our Kickstarter discussion, and we are discussing Pediatric Cancer Awareness Month, September. We are joined by one of the experts in line with cancer in Uganda, and will be telling us just about everything that concerns the pediatric cancer and how best we can be able to stem what is no doubt a very grim trajectory. But before I introduce my guest, allow me to give you a preamble of where we are. According to estimates from the IARC Global Cancer Observatory, in 2020, almost 280,000 children and adolescents aged between 1 and 19 were diagnosed with cancer worldwide, and almost 110,000 children died. However, the actual numbers may be much higher because in many countries, childhood cancer is difficult to diagnose. The proclamation of Childhood Cancer Awareness Month was made to raise awareness about childhood cancer, which remains the leading cause of death by disease for children under the age of 14. I hope you heard that. Dr. Peter Wasswa is a health worker in that line and joins us to, first of all, give us an update on what the stats and the reality is on the ground in terms of the spread of a pediatric cancer, but also on the Cancer Awareness Month, and what exactly are the series of events that are lined up to ensure that we get to understand a lot more about it. Very good morning and welcome to Morning at NTV, Dr. Peter Wasswa.
Good morning, Chris.
Pediatric Cancer Awareness Month. We've had so many months and initiatives to create awareness of so many things, including the litany of diseases that many Ugandans grapple with. But pediatric cancer is something that is not well understood. I do not know whether it's a case of ignorance on the part of many Ugandans, so much so that awareness can kind of jolt us to finally give attention that is deserved. Just bring us up to speed with what's on the ground in terms of how many children are suffering from the various types of cancers in the country.
So thank you. So it's important that this month was set aside as a Pediatric Cancer Awareness Month, meant to raise funding, support and awareness for children's cancer. And that's particularly poignant in Uganda because most children with cancer are not diagnosed, so many of them end up dying unnecessarily. To give you a bit of numbers, we estimate that for a population of our size, that about 5,000 children develop cancer every 5,000 children.
5,000 are born
develop cancer each year.
They develop cancer each year?
Yes,
okay.
For the population we have. However, the vast majority of those are not actually diagnosed and don't come into care and actually end up dying. But also the few that are diagnosed, many of them end up coming late because of delays in actually believing or suspecting they may have cancer. Even those who come in hospital, sometimes there are difficulties in terms of treatments, in terms of investigations, and as well as keeping into care, adherence into treatment. Okay, so a lot of them end up dying unnecessarily. And that's a sad thing because for children cancer, the vast majority of childhood cancers are treatable. And to give you an example, in high-income countries, where awareness is kind of further along, over 80%, actually approaching 90% of children with cancer are cured. While in poorer countries such as ours, less than 50% of children with cancer are cured. And I would say less than 10% because the vast majority, certainly in Uganda, are not diagnosed.
Let's talk about two scenarios here. Reported cases of cancer among children and underreported. Let me begin with the not reported or underreported. When people develop these complications, and either in rural communities, it's attributed to so many other things, including, regrettably, witchcraft. How do we ensure that the services much needed to ensure that those cases are identified and allowed to come forth so that they can be attended to is achieved? Is there any particular deliberate effort by the government to ensure that the rural areas are reached so that some of these cases can be diagnosed for those that do not have the resources to reach out to the centers like UCI?
Yes, so the first step is really making sure that all children have access to a healthcare facility, and that healthcare facility is staffed by competent health workers that are able to suspect a diagnosis of cancer and possibly seek advice and referral. Obviously, even before the center, before the patients to come to the healthcare services, the community must be engaged and have the belief that actually it's worth taking care in a hospital, in a place where there's formal trained personnel. Okay. Now, there are many steps along that way, and that is still, I'm not saying we are yet there, but I think there are steps in the right direction. Certainly setting up health center 4s and other lower centers is a step in the right direction. Because once patients can access a trained health worker, and hopefully that trained health worker is competent enough to diagnose cancer or suspected as of cancer.
Escalate the case.
And escalate the case. Then that's kind of the first step. So part of our journey really is manifold. Number one, we need to make sure that the health care workers in those places actually got training, and suddenly, even when they suspect cancer, they know who and where to refer. So that's very important.
Okay.
And part of what we are doing at the moment is, and what we continue to do, is ensuring that health care workers in training have access to training on cancer, starting to know what the symptoms are, the signs are, and to interpret tests that may suggest cancer. And equally, we're also doing what we call outreach activities. There are not many cancer specialists, so it's very difficult to reach everywhere. But it's a start. We're trying to reach some of the hospitals and share experiences. And hopefully, once people know about the cancer treatment exists and it's successful on the whole, then hopefully people will be more engaging.
Okay. On the reported cases at, for example, the Uganda Cancer Institute in Mulago, among children, what are the most common or rampant cancers that we see, and those that people should actually be on the lookout for, not necessarily because they are the most rampant, but because you need to actually be on the lookout for all types of cancers, not necessarily those that are rampant. How do we see this manifesting? What should we look out for? What are the quickest signs, for example, that your child could be developing cancer?
Right. So globally, the most common childhood cancer is blood cancer, leukemia. Okay. And there are other cancers. There are brain tumors, brain cancers. There are cancers of the lymphatic system, they're called lymphomas. There are cancers of the muscles called rhabdomyosarcoma. There are cancers of the kidneys, some of which are called Wilms tumor, and the others which are neuroblastoma. There are different types of cancers, but overall those are kind of very common cancers. I would say that the way cancers manifest in children actually often is very similar to general disease of children. The difference is these diseases often don't go away with simple treatments. Okay, and they persist on until they get a cancer diagnosis. So one of the things I think the first step is, if a child is unwell, they need to see a trained health worker, and hopefully that trained worker is able to pick up that this is actually not what a common child, this is not an infection or other child common illnesses, that the signs and symptoms may suggest to cancer. Okay, and one of the things to suggest that is if they have abnormal blood tests, or the symptoms are not going away, or they are very unusual symptoms. What most people will be familiar with in terms of signs and symptoms is going to be swellings. Swellings. For example, swelling in the tummy that doesn't go away, a swelling on the eye, a swelling on a particular part of the body. But that said, not all cancers will present with a swelling. For example, blood cancers.
Not all swellings will be cancer.
Correct. That's why it's important that patients can access a trained health worker, so that and hopefully the trained health worker is trained enough and competent enough to be able to tease out what is maybe cancer and what is likely to be something less sinister.
Allow me to dwell on the fact that a health worker ought to be competent to quickly figure out whether actually there is a possibility of cancer when a child or a toddler has been brought in with a high fever and all attention is being given to symptoms for malaria or any other infection. Do the health centers that we have right now, especially those under government control, have the ability or the leverage and the resources to be able to say, here you are, there is a toddler brought in and the symptoms are malaria, but we have the time and resources to also test for perhaps cancer? Is that something that is available, or its cost?
I would say everything is available, and I think we know that there is under-resourced. Most of the health facilities are under-resourced.
That's right.
They're understaffed and under-resourced. So it's always going to be tricky, even in good resources settings, to actually diagnose these patients. But what's important is that, for example, if a child comes with a fever, And yes, most likely it's going to be an infection because that's what's more common.
Yeah.
But if you do the test for an infection, for example, malaria, and there's no malaria, then you need to be thinking again, could it be something different? Okay, could it be a virus? Okay, normally viruses litter their way, and a few days they're better.
Yeah.
But if something persists, a patient is seen with a fever that doesn't go away, then somebody may be thinking, maybe I need to do blood tests. Maybe I need to be thinking further. Maybe I need to do, and particularly if they're coupled with other signs. For example, if a child has got fever, but they've also got anemia.
Yeah. Or
they've got fever, they've also got swellings in different parts of the body, or they've got bleeding. Okay, then that should be kind of triggering off the suspicion that this may be something actually more complicated than what is than the common childhood.
All right, among the older persons in the country, many times when we report the news of the death of some of the top officials, that is just a percentage of those that have died as a result of cancer-related complications. And it's always very common for people to attribute some of these cancers to lifestyle. What we feed on, how we consume what we consume. Some are told you are negligent. For example, you do not do physical fitness programs that ensure that you are all right. Now, when it comes to feeding and what we eat, the children are highly susceptible because many of them are feeding, especially within the urban areas, are feeding on so much junk. And it is reported, and very many people are afraid that perhaps this could be contributing to some of those cancers, and especially the fact that they are becoming rampant. Is that true?
So lifestyle has a limited role, almost no role, in the causation of childhood cancer.
Oh, childhood
cancer.
Okay.
Children haven't, by default, children haven't lived long enough for lifestyle to have impacted and caused cancer.
Okay.
Yes, you could argue that some of the beginnings of lifestyle abnormalities start in childhood and eventually continue adulthood, and maybe that is actually result in cancer in adulthood. But certainly for childhood cancer, lifestyle isn't something that is of much importance in terms of prevention of childhood cancer.
Okay.
As I would say, the vast majority of childhood cancer, we don't know the cause. There are few isolated causes where we know. For example, when we have HIV pandemic, there's a virus called human herpes virus type 6 that causes a tertiary cancer of cancer called Kaposi sarcoma. But the vast majority of childhood cancer, we don't know the cause.
Interesting there.
And we can't prevent it.
You can't prevent it. All right, when you visit the Uganda Cancer Institute in Mulago, you can see many toddlers on the veranda, and this has been attributed to the lack of resources to ensure that they are put together. Recently, we heard that the Cancer Institute and other stakeholders had come up with what was described as a care home to allow for those that are unable to find accommodation when they come into Kampala to access the Mulago-based institute where they can be kept. Is that something that will significantly perhaps reduce on these cases or improve care, for example?
Yeah, so just to clarify, I'm not a spokesperson for the Uganda Cancer Institute, but I'm speaking about Mulago in general. I'm based in Mulago. So in Mulago, and there are nearby facilities, which offer accommodation and lodging and food and transportation back and forth for for patients that maybe whose home areas is far from Kampala and they can't commute on a daily basis. So there are those. There's one in Kawempe. There's one in Makerere called Bless the Child Foundation. Those offer a lot of that. So that helps. Suddenly, the cases of children sleeping on the veranda isn't quite common. I think it was more of the adults, but certainly for the children, there have been those facilities in place for a few years now, and those are very helpful in trying to support families, especially those who live far from Kampala. But the notion that actually facilities are coming up to support patients, even adult patients, is a very welcome development. Certainly. All
right, in regards to the awareness campaign, the Gold Ribbon and what it represents, quickly put us through that and then tell us exactly what the series of events are as the month inches further.
Yeah, so September, the whole month is dedicated for childhood cancer awareness. There's going to be a series of events, media engagements, just as this one, to raise awareness. There's going to be trying to access the social media platforms to try to,
No, it's all right. It's okay.
Okay.
Yeah.
Social media platforms to try to, again, increase reach out to the population There are going to be some, probably there are going to be some symposia held around. There may going to be a charity walk, again to bring up the cancer of the fore. There are also other things that are planned, for example, TV interviews, media, the media engagements, but also blood drives. So there's a series of events, and different cancer treatment centers in Uganda have tried, have also done separate things. In Lachoy, in Barara, and elsewhere. I think they're also doing other.
All right, Dr. Peter Wasswa, many thanks for the insight, and I've learned a lot, and I'm sure that those watching now understand the dynamics regarding pediatric cancer. We do hope it's something that the stakeholders that are fighting and ensuring that this particular trajectory is reversed will have the best possible resources to be able to achieve